Ideally CAR T, especially with the two separate products that we have approved for patients with mantle cell lymphoma currently. We wanted to take a look and estimate the sort of the cost and determine the differences between whether the patient can be treated inpatient or outpatient, because especially within the United States, we are trying to reduce the cost burden associated with CAR T therapy. And in certain situations, we've done this by trying to move some of these treatments to the outpatient center to avoid some of the inpatient costs, ICU stays. So in this situation, we tried to estimate the cost savings that would be provided with liso-cel if this was the preferred CAR T product used compared to what had previously been used with maraleucel in this patient population. So in this situation, we looked at the different costs between patients who were able to receive liso-cel and actually stay outpatient versus those who received liso-cel and went inpatient. What we could see is that the cost associated with liso-cel was significantly less than what we would typically associate with CAR T therapy in patients with mantle cell lymphoma, specifically because a higher percentage of patients with liso-cel were able to remain outpatient, thus reducing the healthcare burden and cost. We had a few outlier patients within the protocol that sort of escalated the cost a bit more than what it actually would have been, because we had a few patients who had some severe events required ICU stays, which basically artificially inflated the overall cost of some of the patients who are outpatient. But overall, it looks like with liso-cel, especially if you can keep those patients outpatient, it would be a dramatic improvement in the cost associated with the typical $250,000 plus of money that it costs a patient to receive CAR T therapy.